this intervention, we heavily discussed character strength. But the goal isn't really just stopping there, but the goal is to help them to first feel the feeling of flow, getting into the flow state, and then also help them to increase the number of activities they do so that they are more likely to enter flow in more hours of their day. And then we discussed the three necessary elements for flow, which is perceived fit between challenges and skills, clear goals, and sense of control of one's consciousness or psychic energy. Well, this is a debatable area. Some may have different ideas, but this is what I did with my intervention. So the procedure is that we first do the strength part. We will take their strength test, and I talk to them and help them identify their top character strengths and how they use them, how they may using them in the future. And then we explore all of the strengths, because we spend several sessions just on character strengths. And so by the end of the 8-week counseling intervention, we have explored all 24 strengths. So I made strength cards. They could randomly pick the ones they find interesting at the moment. And so that's how we did the sessions with the strength. And then starting from session 4, I started to introduce the concept of flow and why flow is important, and the core elements of flow were also introduced in that session. And then the sessions afterwards, our conversations were based on a blend of character strength and flow, depending on where they are at the stage. So some key takeaways is that focusing on the positive can help reduce or eliminate problems. Especially for OCD, it's not very easily curable, but at least by the 8-month post-intervention, he was good. The YBOCS scale showed non-clinical level of his symptoms. I'm going to follow up with him soon, because right now it's about 12 months. So if he's good for 12 months, then I think it's evidence-based to say that he's cured already. And also their medication levels have reduced. So for patient A, she's no longer taking medications, and for patient B, he just takes medications when he thinks of it. When he forgets about it, he just doesn't take. So certainly reduced. So I think he started to reduce medications in session 4 or 5, which shows the power of character strength and flow. And so I think positive psychotherapy can be offered alongside treatment as usual, because it has unique mechanisms for therapeutic change. Why? Because I don't think medications would reduce one person's perfectionism, but that was key change observed in these patients, and it was through a better accepting of oneself and a better accepting of of the world around them, that they reduce the level of perfectionism, and as a result have better social relationships, especially for the OCD patient. He was very afraid of others touching him, even just not dirty or without contamination, but that was his fear. But now he's no longer cares about that, and he can interact with people normally and enjoys much better relationships with family and friends. So that's my presentation. If you have further questions, feel free to email me.